Hi guys, my name is Dan, I'm a veterinarian, and today I'm going to talk about the 2 ways a veterinarian will hydrate your cat or dog. Now, unlike people, when we think about hydration, we think IV fluids. That is one route a veterinarian will take to hydrate a doggy or a kitty, or various other species. However, there is one other option, and a veterinarian will pick one of these 2 options based on what they see in the physical and what they believe is the most appropriate for that pet. The first option I'm going to talk about is sub-Q fluid therapy. Sub-Q is subcutaneous fluids, which is that layer of tissue, like the fat, right under the skin that allows for the veterinarian to put fluids under the skin into that fatty area of the body in dogs and cats. Unlike humans, cats and dogs have a lot more wiggle room to that sub-Q space. A veterinarian will take a needle and they slide it right under the skin, kind of like they're giving a vaccine. And then they'll open the fluid bag up and the fluid will rush in to the sub-Q or fat space in a dog or a kitty. I know, right now you're thinking, how is that possible? The nice thing about sub-Q fluids that intravenous fluids doesn't offer is if a doggy or kitty needs to go home right away, a veterinarian can put the fluid under the skin and the fluids can move through the body through the course of a few hours. Unlike an IV catheter where the doggy or kitty must be in the veterinary hospital. Now, of course, this is 100% up to your veterinarian. The sub-Q fluid approach is not as aggressive as IV fluids or intravenous fluids. Sub-Q fluids diffuse into the dog or the cat over hours. It's not immediate. In the more severe cases, let's say we have a doggy who's really sick from like pancreatitis or a foreign body or some kind of horribly high fever. IV fluids are when a veterinarian puts an intravenous catheter into the arm. The veterinarian will try to put the biggest needle into the arm because that will allow for the most fluids to be delivered to the doggy or the kitty in their time of need. Either way, when a veterinarian does a physical exam, they may do a skin tent, they may do a capillary refill time where they press their finger on the doggy or kitty's gums to see how hydrated we are. And based on hydration, based on the physical, based on the lab work, based on all kinds of stuff, based on all that, we will pick a method of fluid delivery that best fits that cat or dog or any other species. Remember, the veterinarian wants to make sure that they are treating the problem, but also the symptoms if it includes dehydration. As always, guys, I hope this was really helpful regarding sub-Q and intravenous fluid therapy in doggies. If you have any experiences, please comment below. Please like and subscribe. I greatly appreciate it. And you guys have a great week. Take care.